let me just spend a minute or two recapping. Last week, the first thing we really went over was just introducing our panelists and hearing what their individual stories are, and certainly that they are individual and they come from different directions. It was great to hear that. We asked, what was the spark that got them, that ignited their burning passion to do this on their own, which is not an easy thing to do. It's easier very often not to take a risk, and yet you're looking at four very brave women who decided to go out and do it on their own. Just a quick background. This is being sponsored by Teledentix. We are a software company. We have no intent to advertise software here, but I do want to bring in the tie-in. The tie-in is the fact that 4 years ago when we started the company, we really started it to support Paul Glassman's virtual dental home model for teledentistry, which many of you probably already know. That's typically a hygienist, independent hygienist in California going out to remote settings, whether that's a school or a senior home, community center, et cetera. Doing what a hygienist can legally do, typically preventive services, but maybe a little bit more, and also gathering diagnostic records to be reviewed at a later time called asynchronous review, and then make recommendations whether further treatment is done. There was no software in the market to support that particular model. So when we started the company, my business partner and I had been doing software development for many years in dental. So we went back to our roots and began developing Teledentix to support that model. Well, that model, of course, is mobile. And so while it was teledentistry at its base, it was mobile teledentistry that we were developing. And you can actually take the word teledentistry out if you want, and it could just be supporting a mobile model. We combine the two together. We think it's a better model, but nonetheless, it could just be mobile in and of itself if we wanted to stop there. So because of the fact that we are mobile and mobile teledentistry, we started hearing a lot from hygienists who had independent practices or were thinking about independent practices, and saw, whether it was finding us on the web or hearing about us, would come and talk to us. And maybe the biggest question we got was, I really like this idea, how do I do it? And while we had a lot of anecdotal things we could talk about, we realized there was no good model that we could send them to. So we began asking other hygienists if they would give their inputs, and realized that, why not put something together like this particular series and bring some real pros into it, people with experience, and start asking questions that could answer some of the things that maybe a new hygienist, independent hygienist might want to ask prior to going out for the first time. So I'm going to start today with just that question: how do I start? And that's very often in business, that begins with business planning, but very often when we're having discussions with hygienists, that question begins with, what equipment do I buy? So really the first question that I'm going to ask each of the hygienists, probably Joan, Felicia, Jolene, and Kathy in that order, just, where did you begin? And what would you suggest the first steps might be? Joan? I think you're on mute, Joan.
Unmute. Hi, everyone. Good to be with you again. For me, it was a capstone project that I did in a degree completion program. So that was the impetus for the structure around creating this model. There was a lot of other things that went into the vision that I had, but the process of actually starting a business has to start, I believe, in the planning stages, because you have to choose a lot more than just what equipment you'll buy. I mean, you have to choose who are you going to market to? Who is your audience? How are you going to do that? There's legal issues, and we know as hygienists there's a plethora of legal issues. Some we have to bust through barriers, and others we have to take what's given us and then move from there. So for me, it was really having an academic base to create the project. And so in that process, I was able to pull all the pieces together. So I started my capstone in an entrepreneurial class in 2012, and I actually opened the business in 2014. So I had to actually decide on what structure I was going to hold for the business, and then get all those legal ducks in a row. And then I had some personal experience with doing mobile care in a hospital dental program that I was involved in back in the 90s. So I had an idea of what to do. Sometimes what we see in some of the states with this model is they're asking hygienists to go out and shadow or model with someone. Because that's very important and gets the juices flowing. But for me, it was really the starting point was that capstone as a project, and then building upon that.
Sorry, it's on me that was on mute this time. So there was approximately a year of planning prior to seeing your first patient?
I would say there was 2 years of planning before.
Oh, 2 years of planning. Okay.
Because that's another thing. You have to, you have to create your patient, who you're going to start to see. And in my case, the laws in my state kind of helped that along, because I had direct access to serve the homebound. So that became my, population that I went to. But through networking and things like that, I started to build contracts with assisted living facilities and just developmentally disabled program. And so I started with working with those teams, putting it together, and then starting to create a patient base.
Okay, great. Well, I'm going to circle back and ask you more about how you got patients and how you can potentially make money at this business too.
But yes, it was about a 2-year period between starting the capstone and actually opening the business.
Okay, and when you did, as you were opening the business, where did equipment fall in? Not that I don't want to get into equipment right now. I just want to know in terms of the sequence.
Do the words beg, borrow, and steal mean anything? A little bit of this and a little bit of that. I knew that I was going to keep it really simple and survey the scene and use whatever I had in the home. So I wanted to keep it very simple. I didn't start with the process of having a lot of the mobile equipment. One, I didn't want to schlep it. Two, I think that this population that I'm serving doesn't need a lot. So I think you want to look at it. Now, things might change in the future, but for now, I kept it very simple. So I had instruments and supplies and things like that. I work out of my home. And then I go to whatever home or facility of the patient that I'm seeing. And I bring my kits and things.
I'm sorry, and what was the time frame prior to seeing that first patient when you started getting the equipment? Was that a month before? 2 months before?
I'm trying to think of the equipment. The basic piece of equipment that I purchased was a computer.
Okay, because you had all the other stuff at home.
And the other thing were instruments and putting and supplies. I had a relationship with a supplier, and so they helped me. But it's mostly in supplies, less so much in equipment.
Okay.
More in, yeah.
Great. Well, Felicia, I'm going to jump to you and then just get back again to the basic question. That was, where did the process begin for you? Again, I think again the question is do we start with equipment? I think everybody agrees no, but where did it start for you?
Good afternoon, everyone. As for me, my situation is a little bit different. I started out in Africa, and my passion is what drove me to serve the needy. So I pretty much started with whatever I had. I graduated hygiene school in 14, and I founded the organization in 15. So that's basically what I started out with, the instruments that I had, the equipment that I had from hygiene school. And of course, I was calling around to all the different dental companies to see if they could donate supplies for me to go and serve the needed people in Africa. And that's basically where I started. And I started at an orphanage in Africa. And of course, we didn't have suctions or anything. We just had cups, and we just made what we had. We made do with what we had. But and then when I came back here to the United States, of course, there are laws here. and I looked into doing a business plan, but I just went with what I had, and until I was able to get more donations.
So yours was baptism by fire.
Yes, yes.
You just jumped in. Well, yeah, that's interesting. There's probably a lot of people that have a similar story to where it was just, well, I'm going to do this, and I'm just going to jump in and do it. What about you, Jillian? What was your process prior to seeing your first patient? You're on mute too, Jillian.
There we go. I feel like it was a long process because I really enjoyed community dental health when I was a hygiene student almost 20 years ago. And I wrote a grant and started up a rural mobile children's school health program with a friend, dental hygienist, and it was a lot of fun. It was a partnership between the Children's Health Alliance of Wisconsin, because dealing with the schools, things are very regulated. And then when I came to Florida, I couldn't really work outside of a clinical operatory, and I worked with the Hygiene Association. And then when our practice laws changed and I was able to make a change in 2012, I did some different things in public health, and I did a lot of volunteering with seniors and with children. And then I took a position as a mobile dental hygienist for a senior care company in nursing homes. And I really enjoyed it much more than I thought I would enjoy it. And it just was really rewarding, but I couldn't provide the care that I really wanted to provide. So in 2019, when Florida adopted teledentistry, is when I contacted a dentist and started the planning process. And that was just a couple months before COVID. I attended the American Mobile Teledentistry conference that was in Orlando a couple months later, right before the pandemic shut us all down. And that really helped focus the direction of my business. The business itself was really a year in planning. I would say that I started to purchase equipment and supplies about 3 or 4 months before opening up the business, but that was kind of the focus of it, if that helps you.
Well, it does. And I think your business plan right now is fairly extensive. I mean, how did you get from there to here?
COVID has kind of taken my business plan down some twists and turns that I wouldn't really have anticipated initially, that it was going to go in that direction. And I think that it was a little bit maybe more delayed in opening up because of COVID and my target population being seniors in assisted living facilities. But I realized that because of the restrictions of COVID, maybe it would be a really good idea for me to be more open to other opportunities that are out there.
All right, Kathy, what sort of planning did you do before you finally saw your first patient?
Sorry, I put in for a grant. I was one of the first. There were 6 of us in the state of Massachusetts that got a grant to become the first public health hygienist in Massachusetts. So that's kind of where I started, and they gave us an equipment grant. I think it was maybe $5,000, and then they said, go forth and clean teeth, which there was no direction or anything like that. So my suggestion for people who want to do this is I would print your state laws, and I would read them, and I would read them again and again and again. I would read them at least 10 times. I would highlight certain things that are very specific to you and how you can practice. And I would stay within those parameters no matter what. There will be dentists out in the world who will want to stop you from progressing down the public health road. So stay in your lane, first of all. Second of all, I think that the next thing I would do is I would print up some business cards. You know, think about a name, what you want to name yourself, and print up some business cards before you do anything else. And then I would go out to facilities, and so assisted living facilities and nursing homes, and find out what's already being done out in your community. Find out where you can fit in. Maybe, you know, like in Massachusetts, lots of it's, although I do 2 school systems, a sealant program, Profis, and fluoride varnish program, many of the schools in Massachusetts have the kids covered. So it's very competitive. I ended up collaborating with a dentist who asked me to help him out with some nursing homes, and that's kind of where I veered off into. Although I still do those two school systems. So go out and talk to people. You're gonna have to put the time in. You're gonna have to make the phone calls. You're gonna have to go say hello, bring a bag of cookies with you, whatever it is, just to get in the door and say, hi, this is who I am, this is what I'm doing. We live in an age of Amazon. We can all get equipment within 48 hours. You know, the equipment doesn't matter. Find out who your target audience is, and then build from that. My suggestion is you file for an S Corp in your state. It has the best tax benefits, but that's a tax a question. Lots of people start out as a DBA, doing business as, and that is all comes in as income on your Social Security. So doesn't an LLC. An S Corp separates you from personal liability and corporate liability financially. Then you have to think about, you know, malpractice and general liability insurance. We're used to the malpractice, but we're not used to general liability insurance. And that's if you go into into an assisted living and somebody trips on your cord and falls down and fractures their face, you know, who's gonna support you if there's a lawsuit entailed from that? And that's general liability. But equipment is on the last tier. First tier, read your practice acts and go out and just go step by step and try to pinpoint who your practice is.
And that's really an important point. We're going to kind of close off later with equipment. We'll come back to Kathy, who's got some pictures and a great setup to talk about equipment. But I think you made an important point of you better have the patients first. If you don't have the patients first, you're going to be in trouble. And you've just given some good advice. I mean, is there any general other advice? And I'm going to ask everybody this too. You've got your own experience, but if you were just offering advice in general, what would you say to how to go get patients? And at what point do you say, okay, now I have enough to move forward?
Well, I agree with Kathy. You really have to look at the business structure, which is part of the project that I did, and I chose an S corporation for my agency. So I think there's homework to do, and that's one of the things. And obviously, absolutely, liability and general liability. If you are going to, however way you structure your business, if you're going to be seeing patients in an assisted living facility, say, that you're working not only with the patient, you're working with the facility, and you're working with the DPOAs, or what's called the durable power of attorney, and the health attorneys. These are family members typically, but it could be attorneys. So there's a lot to know about the model, this particular model of mobile care, but you really need to be cognizant of the legal and the insurance needs that you must have in order to practice this way. For me, prior to COVID, I had built up 6 contracts and about 250 to 300 clients I had seen. And I was hitting my own personal critical mass with that. I had a part-time hygienist that I was working with as a student that helped me. And of course I have my supervising dentist, but it becomes, you have to look at the structure of the business and the revenue coming in, because at some point, if you want to grow and scale, you have to hit your own particular ability to see as many as you can. And you won't know that until you start to see clients.
Were you like Kathy then, having to go out and knock on doors? I mean, how did you get those?
Yeah, I got my first contract with the disabled. It was a community group that took care of special care children and adults. And I got that through a colleague who, in a meeting I was in, said, "Hey, they're looking for this, CPHDH, which is my like the RDHAP, all these, titles that we have now." And so that was okay. Well, sure, I can do that. I've done that. So that was my first. And my second one was I did networking with a healthcare group that serves elders. So there's all kinds of different things that you can do. You could do Rotary work, you could do presentations, things like that. But I just happened to belong to this group. I can't even remember now how I started to do that, whether I just dug around. And just so happened that one of the executive directors who happened to be there at this networking group, his residents were saying, "Look, we need in-house oral health care." And so it just, you never know, you're at the right place at the right time. And from there, you start to build the relationships and build your credibility. And then for me, it just built by word of mouth. And through this networking group that I work with, yes.
So inevitably, if you stick around long enough and you're good, you're going to get new patients, but you have to start somewhere. And so I guess that is a lot of knocking on doors. Felicia's offline right now. She's listening, but I will bypass her. Her journey was so unique. I think in many respects, she just opened the doors because she had such a great gift to give the community. They came, but maybe next time we could ask her.
And she, what? She was fearless. She didn't have any of the stuff, So she like to graduate and then the next year start this nonprofit. I mean, kudos to her. That's incredible. No, bravery and courage, definitely.
No, well, there you go. 2 important things. And so, Jolene, I'll let you tell us how you got your first patients, and not only yours, but how what you suggest.
So my first patients, during COVID, seniors, my first assisted living facility was through actually my accountant, who happened to be a POA, so have the power of attorney at an assisted living facility, who really wanted to have oral care for their residents. And she knew that the only way everyone was going to be comfortable for me to do that was at the start of this year, was for myself to be vaccinated along with the residents and the staff to be vaccinated. So they invited me to come and get their first vaccinations in early January with them. And then right after that, I started providing care for them. So that was the initial part of it. The rest of it really was knocking on doors, going to assisted living facilities, and talking to my fellow dental hygiene colleagues and friends, and some social media. And that was kind of how it all began. But I'm still really new at it.
Well, it sounds like there's a common theme. You got to go out and knock on doors and find the patients. They're not just going to come to you to start with. So
That is true.
Another avenue is Council on Agings. Every town has a Council on Aging, and if you're willing to, I'm pretty passionate about oral systemic link, and a lot of people that, you know, previous to going into a nursing home or assisted living, they're quite healthy and living in their own home, but they have a very limited income, and they stopped going to the dentist because they couldn't believe how much it costs to have a, you know, a prophy and an exam and a couple of bite wings done. So they stopped, but they have all these other comorbidities and that are just going to get exacerbated. So I went to the Council on Agings and I said, listen, I'll provide services for you. A lot of Council on Agings call me to come in, because you have to understand, they're all in a network. So there's a Council on Aging network throughout your state. There's an elder care services network throughout your state. Tap into those places, as well as, you know, go out and introduce yourself. You might want to only work 10 miles from your home. You know, the internet's a wonderful thing. Find out what, you know, locations are near your home. Go and introduce yourself. So for the seniors that I see at the Council on Aging, I provide them prophylaxis for very inexpensive. So they're thrilled. You will never find a more grateful group of people in your life, because they want to take care of themselves. They just don't have the finances to go to the traditional setting. And they're very happy with the services that are provided for them. So just know your audience. Tell people this is what you have to offer. For me, I think that if somebody's coming to you at an alternative location instead of going to the dentist, you should not be charging them the same as services that they would get at the dentist. Or else they would go there, or else you would say, go to the dentist, because you can't do the fillings and whatnot. So to me, I don't feel as though I should be charging the same rate as, and I'm still making more money than as if I was in private practice. But I'm cutting it in half and giving the discount to the people that need it. Does that
I think
make
that's,
sense?
yeah, it does. And I think I've done business plans with hygienists before, and you're right. At half the price, you can still make more than in private practice. That's a hard point to get across. You know, it's just logically that just doesn't, or emotionally that just doesn't fit. Logically, if you see it on paper, you see it, but it does take a full schedule. However, you know, and I'm right now, just so we don't run, we're going to run a little over time. But Kathy, you've got those wonderful pictures on the equipment, and I would like you to go through those in the last couple minutes that we have. Because this is of interest. Again, maybe it shouldn't be topic number one, but it's really a top of everybody's mind. So if you could just go through what you have there and explain a little bit about it, we'd appreciate it.
Sure. So this is a Dental Works sealant unit. So it's just air, water, and high volume and slow suction. I use a chair cover and drape it and punch holes in it and attach my hoses there. I typically will use a zero gravity chair, and you can purchase those anywhere, and you can get a bag that goes over them. That's what I did for a long time, but senior citizens have a real hard time getting out of that chair. So I went and I just looked, it was a brand new on, like, you know, Facebook Marketplace. This is called the Jerry chair. And this is what you will see in a nursing home settings. And it's very easy for folks to get out. It has brakes so that, you know, the chair doesn't move when they go to stand up and all that stuff. This is a box of, but this is the dirty box, and see it's labeled with biohazard material. I put this under the chair so people can't see the dirty instruments once they're being done. This is a saddle chair that I got off of Amazon. I mean, you know, if you're paying more than $80 for a saddle chair, you know, whatever, I mean, dental equipment is you know, overrated sometimes. And this is lightweight. All right. This a little table from Walmart. This was a new acquisition this year, which is the extra oral suction, and I think it's a great thing that makes people feel very safe, and as well as the facilities. And I do have to say, when you start to go out to get business, you have to put ownership on the facility and on the location. It's not enough that they have you coming. They need to be responsible for calling the people back, reconfirming their appointments, and getting them in the door. You can't be doing everything. You are the clinician. If they want you to come and be successful and continue the program, they have to put in some work on their own, and don't feel bad about making them do that. And then this is, it's called the Fat Max Toolbox, and I bring all of my products in there, and then I drape it with plastic. You can see over there, I drape it with plastic. There's a thing here that goes on the end of a picnic table that I found, and you put in for a trash bag. So I put my trash there, and all my supplies. My laptop is over here with my patient forms, and I have a portable scanner. So the equipment's there. It's easy. I get some TJ Maxx bags, throw in my gowns. I have a biohazard bag that I throw the used gowns in, come home and bleach them. A bag separate for patient supplies, like you know, a toothbrush or whatever I want to give them at the end of their visit. My loops, and there I go.
So how many trips back and forth from your van or your car, it must be a van that you're in, how to set this up?
Well, what I do is I have, it's not shown here. I wish I had taken a picture, but there's a cart, and if anybody wants to know it, they can message me. But it's a cart. It's actually made to carry musical equipment, like a roadie or something. But and so the three big pieces of equipment fit on that. This toolbox, this compressor, and this all fit on that. The rest of this, the table folds in half, fits right here on the chair. I turn this chair over, my saddle stool, turn it on and put it on top of the table. And then I just got these really cool hooks, which I love. And I just hang the bags off the back of the hooks and push it out. It's two things I have to bring in and out.
So you are using a van though, probably, right?
I do have a high top van with a ramp.
Okay.
And that is because I invented a portable panoramic machine, and that's the only thing that will carry that. So I do have a high top van with a ramp, but those can be purchased actually pretty reasonable, used.
So
at
and
that point,
how long does it take you to set this up?
15 minutes, maybe.
So you'll come probably what, a half hour before your first patient or something?
Yeah. Mm-hmm.
Yeah.
And the thing is, before you're going to go into a facility, you're going to meet with the nurse, you know, the nurses or the director. You're already going to know where your location is going to be. These are things that you're already going to have signed off. Okay. And everybody's on the same page. You're going to know who's going to go get the patients. Is that your responsibility, or will the CNA come and get the patient and bring them to you? All of these things are going to be worked out ahead of time. So you only have to get there about 30 minutes prior to providing treatment.
And similarly for breakdown then, 15 minutes or so?
Yeah. Mm-hmm. Yeah. Wipe everything down, do my suction stuff there. Yeah. It's pretty, once you get into a system.
Yeah, that's great.
Flows.
So Jillian, what's anything to add? Any thoughts?
I too have a Dental Works unit, and I've worked with a lot of different ones over the years with the mobile companies that I have, but I also have different portable equipment. And it's funny because I see some of Kathy's stuff and I'm like, oh yeah, I kind of like that stool.
Yeah. That's the fun part about sharing pictures, is because you're like, I never thought that would work. That's a great idea. Mm-hmm. And that's why I kind of sent those pictures, because you know what the other practitioners are using.
But I have, it's a 3-tiered toolbox that I bought on Amazon. And I've tried probably 3 different models over the years of doing portable dentistry. And I found the one that, for me, I like that works best. And it's on wheels, it has a handle, and it all closes up into one. And, you know, that's my mode of transportation. But you're right, I mean, I'm bringing a laptop and, you know, different things to be OSHA, HIPAA compliant, and, you know, try to provide the best quality care that you can in a mobile setting.
Are you using a van also?
No, I have an SUV. So
And that's big enough. That's great.
yep.
Yeah. How about you?
I also have been using an SUV for years before I ended up with that van, so.
Oh, okay. Joan, what about you?
I've kind of adapted as I've been doing this for the last 4 or 5 years. But now I purchased a cart actually at Target, and it had a great little satchel in it, and it was on wheels, and it was easy. So I put my things in separate bins, but it got difficult, you know, as I was using that. So I now use these. They actually look a lot like shoe boxes, and they have drawers in them that come out and they stack. And so I've stacked those on the mobile cart that I use. So one of them has my, you know, my stabilization, my caries, SDF, and glass ionomers. It has all the restorative pieces in there. And then I have one for my kits that I put together for each patient. And then the other has supplies. And then my one has infection control where I store my used instruments. So I try to keep it simple, because I do my care not in a one location like this. I go into individuals' apartments. And so for me, I wanted to try to make it as simple as possible. And even when I go into people's homes, it's because, you know, I started my model as a parallel to home healthcare and bringing my care to individuals at home. What we know about people that are aging is they want to age in place. They want to age in their own homes. And so to do this kind of equipment wouldn't work. I couldn't do that. It just takes too much time. If you're going to one location and you're seeing clients all day, and you know, that's when it's cost effective. But for me, I needed to find something that could roll easily, keep some very basic pieces of equipment on it, and go from there.
I also do homebound patients as well. And for that, I don't bring this big suction unit, but I do bring, I have a, it's by Defiblis, and it's just it's a small portable suction unit that you could, I don't know if you're familiar with that. It's called the quiet suction something or other, but you know, there's people that need suction for other reasons, not just dentistry, but
Right.
quadriplegics and home care aides will have different suction units for homebound patients. So that I use. And again, this is something that you build with over time. You know, it's like, okay, well, you know, I really need that. I have 5 homebound patients coming up. It would be worth it for me to purchase that. But I will say, if you can get some locations where you can have people coming to you and see a lot of people in one day, and a lot, I mean 6, 7, 10, 12, whatever, then you can also do the homebound patients, because typically, you know, it's more cost effective for people to come to you, right? You can see more people, so you can bill more. As opposed to going to homebound, I might get to see 2 or 3 people a day.
Right. Well, that's why I have the facilities, you know, assisted living facilities, because at least they're in one location, you know.
When I do assisted living facilities, I set up in the salon, the hair salon.
Yeah. Mm-hmm.
So it sounds to me like it
So,
needs to be a mix, that there's not going to be any one model. If you're just going to
Correct.
do homebound alone, you're not going to make it probably.
Well, if the family can afford, now, if for you, you're gonna have to charge $150 home visit on top of the pro fee. And
Yeah.
if they can afford that, then that's fine. Some
Gotcha.
insurances will allow you to bill out for, like in Mass Health in Massachusetts, you can get a home visit. I think it's $45 or something, but they will allow you to bill out for a home visit.
Interesting. So next time, this is kind of where we're going to pick up, and that is what do the financials look like to make a business like this work? In essence, how do you make money? So at this point, I'm just going to stop it here. This has just been a great discussion. And I'm sure there's going to be some questions associated with this. But again, next time we'll pick it up on how do you make money, and then just your own ideas on what the biggest challenges are that people are going to have to overcome. And I think that'll be an interesting discussion too. But Daniel, do we have any questions waiting?
Yeah, something here that came in here is, it seems like from what we've been talking about, the pop-up operatory is the main one. And you see a difference in mobile is, whether to do a pop-up where you bring the equipment into a location, or you retrofit some sort of van or a dental bus and the patients actually come into that bus. For somebody who's trying to figure out, obviously an investment, I'm sure that the bus is way more of an investment, but what are the pros and cons of each, and what's your experience with evaluating both of those options?
So do any of the three of you have experience working in a van, mobile van?
I do. This is
Oh.
Jolene.
All right. What are your thoughts, Jillian?
That it is extremely expensive. And if you think of a vehicle, of the life of any kind of vehicle, whether it was a mobile RV that I worked in, but we also had a van on one program. I mean, 10 years of daily use is a lot, and it's hard on a vehicle, and mobile dentistry is hard on your equipment. And then you think of, like an RV, you have to have a special type of license, and where you're going to park this thing. And there's a lot that goes along with it. And the mobile portable equipment makes it a much more fiscally doable business plan. And I think it's more enjoyable. And patients, I'm not sure if it was Kathy or Joan about aging in place, and that could not be a more truer statement, that there's dental anxiety. We all know that. But when people are in their own home environment, that just seems to melt away, and they're so much more compliant and easy to work with, and they feel more comfortable. It's more interactive, and it's a much better dental and more personable dental visit than them going to a van. The van is going to be very disinfected, or the everything with it, and it smells like a dental office. And I think that brings on dental anxiety just into its own.
Well,
I couldn't agree more. That's, yep. I think portable is the way to go.
Mm-hmm.
And I work with memory impaired individuals. Yeah. I have seen a tremendous decline over the course of this past year now with my patients that I hadn't seen in over a year. And then that is that when you think about the stress we all were under going through this pandemic, it's tenfold for them. They age very, very quickly. And so there's a lot of adaptations that you need to do when you're working with special care like we do in elder in these settings in elder care. And lots of you want to think about the good that you're doing and the ease of what you're doing, keeping it simple. That's just been a mantra of mine. Keep it simple.
Great. Anything else, Daniel?
Yeah, we got one here about bringing a laptop. So first question is, do you have a laptop showing the dental x-rays that you might have taken? And then do you use that same laptop to enter patient progress notes?
So Kathy, I'll start with you. Good.
I have a laptop designated for x-rays, but I can also, but my software is cloud-based. So, I mean, I can log on and upload or check medical history or whatever. So You would need one. I would have a dedicated laptop for business. I wouldn't say bring your home laptop. It all depends on like how much memory you have on your laptop, because those images are big files and whatever.
Okay. Jolene, I'm biting my tongue because, of course, being an executive of a technology company, I have my answers, but I'd rather hear your guys' answers. So, Jolene?
Gosh, I did a lot of research in this, and I'm a Mac girl, but that doesn't bode well for dental software. And I ended up buying a Dell. It's called a Rugged, because I knew how tough it is lugging the equipment around and the laptop around, that I need something that it's kind of was based upon the military, and it's encased, and so it can handle being dropped and jarred around in a vehicle and things that might happen. And it has quite a bit of memory, and it works well. I have the equipment to provide radiographs and take them with a Nomad type of piece of equipment, and intraoral cameras and all that. And I like to reference that, but I will tell you that I don't do a lot of X-rays with the seniors. It's very difficult for them. I know that Kathy has a portable panoramic machine, and that's awesome. That's not really part of my business plan right now, but the intraoral pictures is extremely valuable, and referring sometimes when patients have to be referred, but being able to provide as much of the preventative services that I can is important. So I'm not sure if I answered that question very well.
No, well, I think a common theme is you kind of need a laptop. What do you think, Joan?
This is Joan. I do take my laptop with me because I use electronic dental records. But I do not, like Jolene, I don't take a lot of X-rays with my population. The goal is to keep them comfortable, keep them safe, and keep them infection-free. So I tend to do more with intraoral cameras. And looking at what's happening through pictures in their mouths. I do dental charting, but I pretty much can tell whether or not the teeth are, the mouth is ravaged from root caries. But going into the future, I want to do more of this oral medicine diagnostics, DNA testing the caries, through saliva testing, and really looking more at the medical management of their oral cavity, because they need so much support, and that's what we can do as teachers of prevention, is work with them, work with staff, work with what's in our toolbox. But X-rays are not big on my just, I probably would have an argument with someone doing standard of care, but I actually do believe with frail elders, standard of care does not necessarily include X-rays.
And that totally makes sense. And in fact, you might even argue the opposite, that it's dangerous to try to do that when somebody's in a position that they're not willing to or can't accept that kind of treatment. Daniel, did we have one last more?
Yeah, let's finish off with this one. It's a great question about Teledentix, so I'd love to ask it. Do you use Teledentix to refer patients to a dental office if they need follow-up care?
Well, let me ask that question in a different way, and that is when people do need follow-up care, is that a service that you take on? In other words, trying to deal with continuity of care for a patient that needs treatment in a bricks and mortar office.
Well, this is Joan, and because I have an advanced scope in my practice of caries stabilization with silver diamine fluoride and smart restorations, I have been able to stabilize mouths throughout their lives before they pass away. So in those instances, you're keeping things stable. For the people that have, abscesses and ulcer, challenges that are beyond my scope, it is pretty much like jumping through hoops to get the referrals and get them out. I mean, especially because I work with the memory impaired and they're in locked units as it is. I do think what we need to build also, besides the hygienist, is the geriatric dentist that is willing to come in and do mobile services, because it's just, it's so difficult by the time you get that referral out. I've done it many times, and now I just try to be aggressive with my caries arresting is what I do.
Mm-hmm.
I don't know if that makes sense to you, Bill, but it's a
Yeah,
lot.
no, oh, absolutely. And in fact, for the most part, hygienists or visiting nurses that we work with also are in that same kind of situation. And usually it means transportation of the patient outside the facility. And that is so hard on that particular population.
And costly, very costly.
Yeah, and usually, it's going to be an insurer that's going to pick that up. So unless they're Medicare, Medicaid, you're probably not going to get it paid for. So it is, it's a tough one, and doing anything you can, like what you're doing, Joan, I think is not only the best kind of treatment, I think it's the only kind of treatment.
Well, we're pioneers, so we're in our, what do you call those, with the horses and the
yeah,
Stagecoach
in the wagons, covered wagons, right? Like we're the covered wagons people trying to, but this is all about systems changes, and every one of us doing a little bit each is what's going to bring oral health and the medical dental integration closer and closer together. The more we're in their world and they see and honor us, this, Kathy and Jolene, when they are working with us, they go, oh, wow, that's awesome. Like they need that. They need us to be in the environment, and we need them to come into ours. So it's,
how you can tell pioneers, right? They're the ones with the arrows in their backs.
Yeah. The road to hell. I know. Paved with good intentions, but yeah.
So I know your model, and I've heard some of the stuff you've done recently, Jolene, but let's just close it off with this. What about referrals? And your population is probably a little more amenable to referring to a treating dentist.
For mine?
Yeah.
Oh, yeah. I branched off into a few different areas, not having the senior population as accessible as I would like in building my business. And so for people that are able-bodied, it's tough to find the referral sources if they're on limited income, like Medicaid and that sort of thing. But otherwise, I've done referrals, and through Teledentix, it makes it easy to send along an X-ray and a, intraoral photo, just like you would do at a private practice office. I mean, it's awesome. It's cloud-based. They get it. It's funny. I find it interesting that some of my referrals took their own X-rays. I guess that kind of made me rethink about, do I want to take these X-rays as much? And I probably won't do it as much, but I'll send, treatment notes or anything that I have on the patient through the Teledentix, because it's HIPAA compliant and, it's all secure. So it makes me feel really good about that.
I keep hearing more and more that intraoral, and not even intraoral photographs in terms of intraoral cameras, but being able to get good photos of the mouth with different devices that are out there is I'm hearing that more and more, that's a preferred method of dealing with patients in a mobile setting. Again, if X-rays are required, that's going to be taken in the office, as you just said, Joanne.
A lot of times, it's a lot less invasive to the patient, and they're much they tolerate it so much easier, and you're not taking out lead aprons, and it's not such a big deal. It's easy.
Oh, that's true. That's true.
Hey,
Well, I
hey,
think
Bill,
we've run against our time here. Huh?
I did want to slip one last one in, Bill, because it was a
Okay.
follow-up question. So it is going back to the X-rays and how there was a common theme of not taking many X-rays. How do you get reimbursements without proof of need by using X-rays and documentation? Are you doing all fee for service?
I'll leave that open to anybody. Do you need, for instance, if you're doing perio scaling and root planing, and you're seeking reimbursement, how do you do that without X-rays? Anybody?
Jolene, this is right now I'm fee for service, but I'm exploring 3 different insurance plans, and I probably will implement them. And I specifically addressing your scaling and root planing, I can easily do, dental charting. So probing depth charting along with the intraoral pictures. And I don't know that it's going to be a problem, but I'll cross that bridge when I get there.
Well, I know it has, just from experience, and especially here in California, but that has been a problem. Where it went from scaling and root planing, didn't require any documentation for a certain category of patient, to where they wanted it all the time. And it basically destroyed that entire industry of going out and helping people that needed it. So anyway,
that's the growing standard of care that I was talking to you before about, Bill, is that when you're working in a setting where it's alternative and there are multiple issues, we have to look at actually creating a new standard of care. And so the challenge, that's, again, that could be a whole other talk, days worth of talking about the challenges that we have. Number one, being innovators. Number two, being direct providers, and then knowing what we're seeing. We're actually seeing these things. So we have a knowledge. And so I think, I think it's unfortunate that happened to that program, because they weren't really looking at the whole picture. And
no, I totally get it, but keep on pushing. Just duck those arrows. That's all right. That's what it's going to take. It would be a great, Jolene, to be in a position where you could go to those carriers that you're cutting deals with right now and cut a special side deal. But when an insurance company is doing 150 million claims a year, they're not likely to change their scenario for a few hundred claims a month.
It's true.
Well, one of the things here I think we want to look at too, Bill, is you want to look at their board of directors and who's making those decisions. And 9.9 times out of 10, it's dentists. And so we have to serve on those boards. We have to be the ones that are helping in that decision-making process. And that's another one of my little things. But, if you see the world a certain way, that's what you see. Now, we see the world in a completely different way because of the populations that we're serving. And so hopefully, as we gain more experience, all of us together, hygienists, we will have quality, be able to talk about what changes need to happen.
What a great note to finish on. So I've got to thank you again. I know we're going to have one more. I could keep talking to you guys forever. But we can't keep you coming back and back and back. So the one more to go over what the financials look like and what you think the challenges that people need to overcome. Again, I just can't thank you enough.